Hello, my name is Jordan Kudlak, and I'm doing my research critique on the return of post-operative bowel sounds after abdominal surgery. It's known that after the surgeries, patients are known to have decreased bowel motility, also known as a post-operative ileus or POI, because of the irritation of the GI tract during the surgery. It's also known that nurses should listen in each abdominal quadrant for 5 minutes for a total of 20 minutes, but unfortunately this is not what always happens. The research problem? The problem that we're looking at is the reliability of listening for bowel sounds for the end of a POI or post-operative ileus. It might be a questionable indicator for the end of the POI. Unfortunately, there's not a lot of information that has been done, a lot of studies that have been done, and a lot of research out there. So there's minimal information that the researchers have went off of. There was some literature review in the study. The first 3 were just research-based sites. It's Medline, Scopus, and Sinol, and they also went off of 2 other studies. The first one was Cannon in 1905, which studied bowel motility after the surgery, and Wildhusen and Schirmer in 1990, which studied the first flatus that it came before the first bowel movement. And this is the article. It's the return of bowel sounds indicating an end of post-operative ileus is a time to seize this long-lasting nursing tradition. The author is Robert L. Massey. The problem and the purpose. Like I said before, there was not much information that was out before this study, but there are 2 main aims for this study right now. First, the researcher wanted to determine if there was a difference in the duration of the post-operative ileus and the time of the first flatus since surgery, with using a rocking chair, which is the intervention, or a stationary chair. The second aim was to determine if there was an association between the first bowel sound and the first flatus, the first bowel sound heard, and the time of the first flatus after the surgery. The study design, it was an experimental design used with the post-test, and the only reason why there was only a post-test done is because they had to determine the measurement of the end of the POI could only be done after the surgery. There was no framework that was identified in the study, and it was a partially controlled environment in a large southwestern cancer center. It was partially controlled because the researchers were able to put the participants into specific groups, an intervention group and the control group. There are also independent and dependent variables. The independent variables were the rocking chair, the stationary chair, and the early ambulation, which was done in both groups. And the dependent variable was the time for the first bowel sound and the first flatus. And the sample size was 66 participants. In the intervention group, there were 34 people, which was with the rocking chair, and in the control group, there were 32 people, which was a stationary chair. The inclusion and exclusion criteria. The inclusion criteria, the patients had to have a digestive system cancer, be scheduled for surgery, English speaking, they're cognitively intact, they were able to ambulate, able to sit and stand from a chair, able to receive medications while sitting in a chair, and able to use a rocking chair or non-rocking chair. In this study, there were no exclusion criteria, such as the patient having mental illness or being under 18 years of age. It was not stated. And how was the study conducted? Before the surgery began, the patients were interviewed by the researchers, and they were told what the objective was, what was going to happen, not what group they were in, though, at that point in time. After the interview and the patients agreed, they signed an informed consent. And then they were randomized into different groups, the control group, which was a stationary chair, and the intervention group, which was the rocking chair. The intervention group with the rocking chair was required to sit in the chair for 10 to 20 minutes for at least 1 hour per day. Each patient was assessed at the same time each day, and that was documented on a sheet. They were assessed for bowel sounds and flatus, and if it occurred or not. The results of the study, they show that there was no significant difference between the intervention and the control group in terms of hearing the first vowel sound and the first flatus. The data was analyzed using a study sheet, which was only filled out by the primary investigator. And as you can see right here, there are mean times for day 1, day 2, and day 3. And as you can see, day 2 is when they had the most occurrence of vowel sounds and flatus heard. 75.3% in the intervention group, the rocking chair group, and in the non-rocking chair group, it was 68.8%. There was only a 0.2 to 6.5% difference in the return of vowel sounds between the intervention group and the control group. So like I said before, there was no significant difference. The limitation, as I said previously in the study, nurses don't listen to each quadrant for 5 minutes. It was proven by the researchers with 54 advanced practice nurses, 9 surgeons, and 19 staff nurses that they only listen for about 30 to 60 seconds in each quadrant, which is not the recommended time to listen after abdominal surgeries. And implications and why it's important to nursing practice. The implication for nursing practice is that listening to vowel sounds is not